my co-author and I, Donald Siegel, who's at Arizona State University, we wrote a piece in early March, or mid-March, that was published in the Jerusalem Post. And there was very little data at that time about, very little clear data about exact death rates and about the economic impact. But we were very confident in our forecast that lockdown was an absolutely terrible idea in terms of the costs outweighing the benefits. And we got a lot of pushback, a lot of angry comments that we care more about the economy than people's lives, and that's not a good trade-off. But I think we were right. I think that if you fast forward 3 months or so now, you see that I think there's very little chance that we'll ever see a lockdown again.
Interesting.
Yeah, that's an interesting point. We should talk. We should make a note about talking about how the experience of this particular lockdown emergency will color or distort even future waves of coronavirus. We have to adapt and we have to learn from this.
In fact, the state, the Swedish state epidemiologist, the famous Anders Tegnell, I don't know if I'm pronouncing his name correctly, he early on as well, he said that eventually everybody will become like Sweden. You can lock down now, but soon enough you'll all be Sweden. And I think he's right. And I think that is playing out. That the economic damage is so great that it can only be done very temporarily, and the end game is for voluntary social distancing and protecting the vulnerable, but letting the economy move forward.
Yeah, so we are talking now about how we will come out of lockdown and how society and the economies will adapt as we progress past the peak phase of this particular strain of COVID-19. One implication I want to check with you is, if the curve is L-shaped, does that imply that most of those years of the 10 years it will take to fully recover will involve very high levels of public intervention or state intervention?
That could be problematic in itself, because the more debt that is taken out, more government debt, it has to be paid at some point through taxation. Reduction in government expenditures is not an easy thing to do, so it's going to be mostly through taxation to cover the debt, and that the loans need to be there, the money needs to be there to borrow. So I'm not sure that the levels of borrowing and state intervention that we're seeing now is sustainable at all. Mm-hmm. Also with interest rates from not just the fiscal end, but from the monetary end, with interest rates near zero, there's not, you could go negative, but the ammunition that central banks have at this point, there's a possibility of quantitative easing again, like in the Great Recession, but they have limited ammunition, I would say, and that can't go on forever.
Mm-hmm.
Interesting.
Are there any particular countries you're worried about economically?
Well, I know mostly, more familiar mostly with the Israeli economy, the U.S. and U.K. economy, and I'm worried about them all. If you look at the data in Israel, for example, the unemployment rate was hovering around 3% right before the lockdown, and most recently it jumped up to 25%. So this is unprecedented. Now the public health officials, the politicians are saying here that lockdown will never happen again, even if there's a second wave. And now with the easing of the lockdown, we're seeing spikes in cases. But it's widely recognized that this kind of damage, economic damage, as well as public health damage, there are unintended consequences there as well, is not sustainable. No matter how much fiscal monetary intervention you have, this can't be done. It's too much of what Don and I like to call economic masochism to do that. It's the same in the UK. I think the unemployment rate right before the lockdown was 3.9%, something like that. And we haven't seen the latest numbers, but some forecasts are saying it could go also around in the 20s, 20% or so. We see that in the U.S. as well, with unemployment hovering around 4% before the lockdown, and now it's up around 14%. Now, that's the official unemployment rate. There's something called the real unemployment rate, which takes into account those that drop out of the labor force. The official unemployment rate only takes into account those who are searching for a job or unemployed searching for a job. If you take into account those who've given up, who've dropped out of the labor force, they're not searching, or they've opted to retire, early retirement because of this crisis, you're looking at something around 30%. So these are unprecedented numbers. You have to go back towards well past the Great Recession, 2007, 2009, past the 1980-81 recession in the States, which unemployment was even a bit higher, back towards the Depression to find levels of these kinds of magnitudes.
Interesting. So just to clarify, because one of the things that we've brought up in this on previous episodes is kind of how do you make good comparisons? And I think there's a lot of danger now, even with COVID fatality rates and things like that, where people aren't making apples to apples comparisons. They're making. So I'm just curious. In terms of base rate, I think it might be interesting to ask. So we're seeing some unprecedented unemployment numbers. What might be the standard rate? I'm just curious if people who drop out of the labor force. So not the people who, as you mentioned, are laid off or searching for a job, but the people who are just either retiring, because it was interesting to hear you say that retiring it also falls into this category, and how much worse do you think, because that happens normally as well, I'm sure, that people do drop out. What's that factor and as a result of COVID?
Well, apparently it's up quite a bit. So the difference between the real unemployment rates, which includes those who drop out of the labor force and retire, and the actual unemployment rate is larger now, from what I understand. Okay. Than it has been in other periods. So in other words, the gap between those two numbers appears to be larger. So there has been an increase, in fact, in the dropout rate from the labor force and in retirement.
Interesting. Yeah. And is that increase
across the various economies?
And is that increase? Do you think
are very poor? And another thing that needs to be mentioned here, I think, is it's very important that there are differential effects within these unemployment rates and these dropout rates from the labor force. Who is being hurt the most? It's low income and minority individuals that are facing the biggest blow to the economy. They're different, and women as well. They're differentially found in certain sectors which are hardest hit. They have less access. They have jobs less often that can be worked at home, that involve remote work. And for women, the child care burden as well when there's lockdown. Even though the spouse may be home as well, recent surveys have shown that still women are doing the bulk of the child care, even during lockdown. So it's difficult for them to juggle. If they have a job and they're doing remote work, it's difficult for them to juggle, even more difficult for them to juggle the child care. So I don't want to venture a guess about the recent upheaval in the U.S. and elsewhere because of the police brutality and all. But I wouldn't be surprised that the lockdown and the differential burden that low-income minority individuals are their suffering is also feeding into to this upheaval as well.
Absolutely. And let's, as a mathematician, I just want to get some numbers to make sense of the world. So, I mean, maybe it's too early to say, and that's okay, of course. But I'm curious. I mean, do we have a sense for what are we talking about in terms of first going back to our earlier question of the delta between, let's say, total unemployment versus recorded unemployment? As we've said, I mean, reported COVID cases is also a huge problem. So there's this consistent reporting problem, it seems like, whether that can ever be fixed.
With deaths as well, I think there are places that are including deaths in nursing homes or retirement homes, and there are other stats which are not including them. And as well in the States, there's lots of speculation that counting deaths has become a political issue and a financial issue as well.
So I like this model that was presented out of some people in astrophysics. Of course, I'm going to say that, but who looked at counterfactual thinking. And so I guess that's what I'm driving at. So when we say counterfactual thinking, we say, well, let's see what the normal progression of the world would be. And then we say, last week we did this episode on multiverse theory. So you go back and you smack something or you change something, and then you say, well, what does it look like now? And then you say, well, there's a difference, and that difference is attributable to some cause. So I'm going to push, and you could feel free to say you can't answer, but I'm curious, like, what's the difference in that delta between the delta being the difference between actual unemployment and recorded unemployment, the pre-pandemic versus, or pre-lockdown versus post-lockdown? We're not post-pandemic yet, but.
Yeah, look, I'm fully in agreement with you that counterfactuals are important here. We need good counterfactuals to be able to measure this properly. And what's the best way to do that is to have a randomized controlled experiment. Right? So you'd have, and we don't have that in this case for the economic impact, if you have social distancing or not, if you have lockdown or lockdown light. We don't have this as an experiment. We can't do that. We can't say, okay, let's take exactly the same economy, the U.S., let's put it in lockdown. Let's take the U.S., same period of time, let's put it in lockdown light, and then we can check the difference between the two. Obviously, an impossible experiment, randomized controlled trial. So we don't have the gold standard for measurements. But what we can do is we can look cross country. And we do have variation in social distancing measures across countries. Sweden, Japan, South Korea versus lockdown heavy. The US, UK, France, Israel.
New Zealand.
And you look at the differences and try to adjust for the age differences, for all sorts of things like that, which would differentiate them, and then look if we can control for all those other factors at what are the differences, and in terms of unemployment, the delta between them, and so on. I don't know the answer to that question about the difference in the real and unemployment and the published unemployment rate in that sense. How is that delta different between, say, Sweden and the U.S. suggesting? I'm not sure. I haven't seen that. But what I have seen is the dynamics of the infection rate and the dynamics of death rates between, say, Sweden and the U.S. or Sweden and the U.K. So just to follow up on that briefly, there's a recent paper by a mathematician at Bristol, the University of Bristol, named Simon Wood, who has shown that the dynamics of the infection rate and death rates are almost exactly the same in Sweden and the UK. So in terms of, and of course, Sweden being the classic lockdown light example, and UK being the lockdown heavy, and we see no difference in the dynamics of infection or death rates, which suggests that lockdown had no effect whatsoever.
Interesting.
Lockdown. And so it only, in a sense, it had only costs.
Yeah.
It did not have many benefits.
It's very interesting you say that, because it brings me back to this principle that we like to talk about in mathematics and control theory in particular. And I'm curious to see, I mean, economic controls in the class I was helping teach last year. It was interesting because some students were doing queuing theory and some students are using these same principles for economics. So I'm not the expert at all, and you should tell me. But there's this concept of bang control, which I think is kind of neat. And if you look at optimal control, so oftentimes it is the most efficient way of actually accomplishing anything. And so this seems like an interesting trade-off. So what is bang control? Maybe I should explain it. If you want to send a rocket to space, the best way to do it, in a perfect world, of course, and you don't always get that, is to burn, accelerate as hard as you can, and then decelerate as hard as you can, and that's it. So you don't want up and down, you want to go as hard as you can, and then all the way down. So theoretically, and of course, that might have some implications, but it's sounding like what you're bringing up is that maybe countries that are trying to implement what might be seen as a bang type approach of lockdowns are not doing a full job of it. So, I mean, we've in California had a lockdown, but it's not been a full lockdown. So it might be, like you said, impacting some people who don't have the option of going into full lockdown much more severely. And compared to those of us who mostly make our living on doing things on the computer, we're very fortunate to be in that position. So I mean, how do you think about it from a control theory perspective, in that there is this thing that needs to be managed, and there's this economic impact that needs to be managed? Is there any theory that tells us what optimal strategies might be?
Yeah, I mean, I see your analogy with the bang theory of a strict lockdown implemented immediately.
Yeah.
But, you know, again, we had, there were other models out there. I mean, that didn't need to be adopted. When lockdown was implemented, we had the South Korean model. Of course, there are those who say that it would be difficult to implement. They did more testing and tracing and isolation. They had the capacity to do that. They had the experience to do that. But then again, you had Sweden. Go back to Sweden again, where they had not implemented these harsh measures right away. Also, in the UK, there was talk in the beginning of trying voluntary social distancing. So that's one of the, that was the alternative that was out there to the bang, that there was the implementing voluntary social distancing, securing the nursing homes and encouraging the vulnerable to self-isolate while we built up capacity to testing capacity and tracing capacity. I mean, the billions of dollars that were spent in unemployment relief and business loans and so on wouldn't need to have been spent in that way if we didn't shut down the economy, but rather use that for public health, for ramping up testing, for producing ventilators right away, for building field hospitals, some of which was done. So this was an incredible misallocation of resources. I think one of the biggest public policy mistakes possibly in recent history. It's surprising to me that there isn't more of an uproar about this. I have to say. Also with the problem of testing, that the CDC, there's turf wars going on. How long it took them to allow private labs to get into the business of testing. So there are a lot of bottlenecks, a lot of government failures all the way through. And so there's sort of this bang of lockdown right away. And you saw one country after the other fall like dominoes. I think Israel is one of the first, and then it was France, and then it was UK, and then in the US, and it was really and it was war talk. It was talk about war powers, executive orders, no legislative input really. So that's certainly bang bang, I would say. But there were alternatives. There's the voluntary social distancing model, rather than infantilizing the population and saying that they can't be trusted to take their own risks into account. I don't know if that answers your question about that.
Yeah, no, I think you're bringing up a very interesting mathematical point to which I don't know the answer, but it's certainly curious, which is that it's not just it's also a networked problem. And so we're talking about control within networks, and that's a little bit more difficult, I think, than if we're trying to say, how do you control a self-driving car? I mean, certainly.
Well, that's why I go the voluntary route, I think, instead of top-down control, which would be more of this control theory approach. Top-down rules and mandatory social distancing. My favorite alternative is to allow people to choose, to rely on their good sense, and the role of government in this way is to encourage people to give information, encourage people to make the right decision and voluntarily, and then reallocate the money to the healthcare system and instead of closing down the economy.
Well, certainly it feels like a big shame that we didn't ramp up testing and tracing early. I mean, if you just think about the systems by which these things spread. But now I'm interested. I mean, going back to the counterfactual, I don't want to get totally sidetracked on my SIR model analysis. But I mean, it's certainly networked, and if you increase risks in a certain area, health risks, I mean, there might be a point at which things are spreading uncontrollably. So I'm curious, I mean, how would you, from an economic perspective, I think I see the point that you're making that top-down approaches it's like smothering a very large space in a blanket, and you're not really getting the impact that you need because there's so local interactions. I think that would only work from
that's the point you made earlier. Yes, I think that's also important, is that to really get the social distancing that was being looked for, or to get the isolation, you would really have to put everyone in prison in solitary confinement, and then it would work. But we do have the interactions even under lockdown. We have 15% of the labor force being categorized as essential workers.
Yeah. We
have people going shopping. We have people, and how much did that contribute to transmission anyway?
Right, absolutely. I mean, it feels like
as opposed to having 85% of the economy up and running. Yeah. Maybe not the large concert halls, as in Sweden, for example. But if you had 85%, would it be a big difference from the 15% in terms of transmission? This is something we don't know. But certainly the 15% may have been quite a bit. It might have been quite a bit of transmission there. So are we as a society willing to put everyone in solitary confinement to really ensure that for time, to really ensure that there's no transmission? I don't think so.
Yeah, absolutely. I mean, if you could say that everybody gets their packet of energy bars and then you go into your hall for a month, maybe. But then, of course, there's still a problem that animals might still be carrying the virus. So there is the possibility, I think, still uncertain how to what extent it's happening of retransmission from the zoonotic side. But I mean,
let me just add to that one more thing that I think it's important to note, that some of these estimates that are coming out now are suggesting that the infection rate was below 1 well before lockdown occurred. So here you have another issue about the ineffectiveness of lockdown, not just the fact that we can't put everyone in society in solitary confinement, but also it was done at a point when R was already less than 1. So there was we had already reached, if you like, herd immunity beforehand. So the infections had peaked and it had been coming back down.
Interesting.
Yeah.
I mean, this
has been shown in the Ministry of Health, a research institute affiliated with the Ministry of Health here in Israel, had estimated before lockdown was imposed that R was less than 1. This Simon Wood paper and the mathematician at Bristol also estimates that R was less than 1 in the UK before lockdown, as well as in Sweden. The Norwegians just came out with that as well, that a study that coming out of the Ministry of Health there, that they believe that R was less than 1. So that's another issue. I mean, how effective was it? How effective was it? It's,
very interesting. I mean,
a lot of dimensions to ineffectiveness, I would say.
Yeah, I haven't looked at these papers in detail. I do find that one hard to believe. I mean, this is my incredulity. It might be proven otherwise, but I mean, just coming back to the SIR model now.
The intuition about that,
mm-hmm.
that the virus has been around a lot longer than we think. So it could have been going back to August 2019. It's been around.
Interesting.
And many asymptomatic cases, sorry, together with the idea that there were just a few super spreading events. So when you put it all together, it can make sense. It can make a case, an intuitive case, why R was less than 1. There's another argument, which is behavioral, which is that also people started to voluntarily distance before lockdown. Since the news was out there and of Italy, China, and so on, people became fearful well before lockdown was imposed and stopped going to the supermarket as often and stopped going to restaurants as often. And so just through voluntary behavior, R was brought down to less than 1 before lockdown even happened.
Interesting. I mean, yeah, that's
John Cochrane makes this argument. He's an economist, financial economist, who used to be at the University of Chicago, is now at the Hoover Institute, and he's been pretty cogent in making the case.
But then, I mean, just pushing back on that for a moment. I mean, how do you explain that? I mean, the basic SIR model tells you that if R is greater than 1, then you see an increase, and if R is less than 1, then you should start to see a decrease. And I mean, now we're seeing.
But decreasing before lockdown. That's the idea. That's the claim.
Yeah. I mean,
we had gone past the peak of infections before lockdown was imposed in most of the countries.
I think it's certainly possible. I see your argument for why the rate of infection. So now we're talking about derivatives, not to be too mathematical, right? But the rate at which the infections were growing might have been slowing down. I do find, especially though, given what we've been reading about and all the studies that I've been seeing about herd immunity, it feels like we're a long way off from herd immunity. So that one I do find very hard to believe.
But there's also a debate about how much of the population do you need for herd immunity. So it could be, there's a lot of heterogeneity in R. So, transmission there's not one arm.
Certainly. I mean, certainly it could be that some things are more transmissible than others, but I think if we're talking about...
So there could be super spreading events where the R is high.
But I think we're still talking about...
Everything else in the population, the R is 0.
I mean, certainly. So there's differences in R. But I mean, how do we define herd immunity? I think we define herd immunity as some fraction of the population, at least as it's commonly defined. The beauty of mathematics is you can always define something differently if you want to. But for now, let's go with the common definition of saying that it's some proportion of the population that has to have immunity to the virus. And how do you have immunity to the virus? Either you ideally are have antibodies or some sort of immune response. And it seems like from everything that I've read that we're still, even in very hard hit places, a little ways off. I do see a lot of merit in what you're saying about behavioral.
I think this goes together also with the clusters, because you see that most of the deaths, or most, but high proportion of the deaths were in each country were very geographically concentrated. In the something like half the deaths, I don't know how accurate that is, but a huge proportion were in New York, New Jersey, and tri-state area. Accounts for an enormous proportion of deaths in the United States. Same in England with London. France was concentrated in Paris. There was hardly any cases in the west of Paris. So the transmission R is going to be very geographically specific as well. So there could be herd immunity, if you like, or R less than 1 already in many parts of the country, in every country. But where the problem is very, very concentrated in certain geographical areas, and also nursing homes, of course, we have to take into account.
Interesting. Yeah. So I think, I'm with you on the idea that R might be less than 1 in many different places, but I think I'd push back and say that it seems to me R less than 1 is inversely correlated with herd immunity, in the sense that if places are very spread out, and I'm 15 miles from my neighbor and I always visit my neighbor with my truck, and not in public transportation, if I get it, it's likely that my family might get it, but it's very unlikely that my neighbor will get it. But that means that, I mean, it's a good thing and a bad thing, right? It's a good thing in the sense that I was watching this YouTube video recently that was talking about the conflicting advice that we're getting from all the different authorities, and that's something we should talk to as well. I mean, maybe in terms of economic impact. But it was interesting because if I'm far away and I transmit less, then it's likely that the base population that has the virus is lower. And that's a good thing, of course, that fewer people are infected, and therefore likely fewer people will pass away from the virus or have severe health complications. So I think, I mean, maybe I'm missing something, but it feels like herd immunity is anti-correlated.
Possibly is the asymptomatic cases that, maybe most of us have had it and we didn't know. I don't know. I think these are questions to be answered. I obviously don't have the answers. But I don't think the epidemiologists have the answers either, because we don't have the data.
Yeah, absolutely.
We don't have the antibody tests. We don't have the coverage that we need to make these determinations.
And that's
I think theoretically, perhaps, again, I'm obviously not an epidemiologist, but just from my own reading of this, it seems to me it's at least logically possible that we could have a huge proportion of the population recovered already.
I would love that. I mean, I think data from Italy is maybe Italy is a good example. I mean, I'm not from Italy, but at least from the papers that we've seen, where you see a huge, if you look at the counterfactuals, you see a huge counterfactual spike. And I mean, from what little I know, I feel like, but then we've talked about confidence, so I'll try and model it for our listeners, right? I think maybe at 68% confidence, I would say that maybe there are areas in Italy which have gotten close to achieving herd immunity, because you just see this huge spike and you see a huge difference between what was normal and what isn't. But I mean, I'm very curious though for your thoughts on what we were talking about earlier in terms of the economic impact I mean, is there a way what about the economic impacts of something like mandatory mask wearing or something like that, which feels like it's, to me, the layperson, from an economic perspective, seems much less harmful and still might produce significant health benefits.
Yeah, this worries me, because if you remember at the beginning of the crisis, we were told that masks don't work. They don't do anything. And then all of a sudden, masks became part of the folklore, so to speak. Now there were some excuses about we needed to save the masks for the healthcare workers. Mm-hmm. I don't think that most of the masks that we're wearing are protective in that kind of environment, the healthcare environment, the paper masks that we're wearing. So how, I mean, do we have good studies about how effective the masks are? And, they could have economic effects as well, obviously. I mean, they create, it creates just an atmosphere of fear and as well. when we think that when we're walking around with masks and we're fearful of our neighbors and we keep away from people and we don't want to go in stores and consume.
Well, is there a sense in which training might reduce fear? I mean, I know we were talking earlier about speed limits, and I would love to talk about this one because, I mean, I grew up racing things my whole life, and so it feels like it's one of those cases where having a certain amount of training or having the confidence, at least from what research that I know so far about masks, I mean, and from first principles, if you just think about droplet emission and fluid dynamics, I mean, it's got to do something. And I think a lot of what we're asking now is these things have effects. And I mean, it seems very likely that lockdowns help you in some way, but is it worth it? Maybe not. I mean, theoretically, the severe lockdown, right? When you were talking about the prison case, that would work.
Well, severe lockdown, we only delay the inevitable.
Well, I mean, it waited long enough.
It was supposed to be justified. I mean, it was justified in the beginning as we needed to do that to not overburden the healthcare system, not overburden hospitals and so on. But once we come out from the lockdown and you get the second wave, you get and we're seeing that a bit too. We don't know yet that it's early days in some of the economies that have opened up. Are they really statistically significant spikes in cases? Mm-hmm. We'll have to see. That would suggest that lockdown did do something, but still, you maybe it didn't. But if we do see that significant spike, then it did. Mm-hmm. So, but it only delays it then, and it was just meant to ease the burden on the healthcare system.
Well, theoretically,
and that's a question in itself to how much did we really need to ease the burden on the healthcare system?
Well, yeah, I mean,
there was extra capacity in many places. There was field hospitals that weren't used. Ventilators seemed to be not as effective as we thought at first. So there's still many questions to be answered in my view about these justifications. Justifications, for example, of the 2-foot rule, the 2-meter rule, the 6 feet rule. The WHO says, no, it should be 1 meter. 1 meter is okay, but we have 2 meters in other places, 6 feet, 3, some places we have 4.
We did do an episode.
This is the same problem I have about how scientific is all of this, about the masks, about the distance. Do we really have, going back to the SIR models, they're plugging in infection rates over there. Are we plugging in the right ones? And is there enough heterogeneity? And
there's lots of questions, but I mean, I feel like we have to be searching for. I mean, I think we're all scientists, right? So we're all searching for some form of common reality out there. I mean, it feels like the goal of science is to agree that there's a reality out there that you can measure. And I mean, call me arrogant or biased, but it feels like sometimes the place to start is in. If you don't know, you start in the little pieces, and then you go from there. So I have this bias certainly towards first principles and mechanisms because I think I agree with you completely that oftentimes if we don't have a plausible mechanism for why things can happen, then you can get very easily clouded in facts and facts without justification or facts without confidence levels or facts that are just thrown out there as
confidence intervals have been completely lost in this in public discourse. Everything is thank you for mentioning that. Everything is a point estimate and with no confidence intervals ever mentioned. I think the confidence intervals must be unbelievably enormous if we knew them. If we could estimate the true confidence intervals, because